Felipe, you can turn on the recording. Got it. All right. Go ahead.
Okay, can you all see my screen? Great. Perfect. Yeah, so that was kind of how it was going to start. This was talking about how this is such a full circle moment for us. Because a year ago, when this group was started, I was actually asked to join, or it was suggested that I join because Utah was so AI resistant. And the feeling was that we needed to have kind of those conversations about, like, well, what about the states that don't have permission to use it yet? We don't want to be left behind. How do we learn about it without being able to use it, and those kinds of things. So we started kind of with that attitude. We had an AI, we still have the same AI policy for Utah state government that we were using a year ago. And it's actually a pretty good policy, but it just says that no AI platforms can be used without approval by our software approval board. But at the time, no AI platforms were approved by the approval board. So we didn't have any AI that we could use, but we had a policy that said we could use it if it was approved. So then we started going about the process of trying to find platforms that and use cases that could be good for public health. So the one that I'm going to talk about today, this qualitative analysis one, this is a pretty basic function of a generative AI platform, but it's one that worked well for us and turned into a really strong use case. And then this use case was part of a pilot program that we did with Google. There was a limited number of Google Gemini licenses that we were able to get to do a pilot project with Utah DHHS. And this was one of the use cases for that use of AI. And now, as of the third, I think it was the third or fourth, we have started, Utah DHHS has decided to give Google Gemini to every employee. We all use the Google platform. So as of June 3rd, the rollout started, and now some of us have Google Gemini embedded into our apps. I don't have it yet, which I'm super jealous of, but there are coworkers of mine that do have it. So I'm just waiting for my turn in the rollout. So for some background for this particular project, Utah is a decentralized public health system. We have 13 local health departments that represent 27 counties in Utah. Many of them are rural or very rural. And we have 8 federally recognized tribes with several public health authorities across those tribal nations. So we wanted to do a data modernization assessment. As the data modernization coordinator, we operate under the Public Health Infrastructure Grant, and we needed to do an assessment to see how we wanted to do some data modernization projects across our public health system. And we decided as a state to approach this from an enterprise-wide, system-wide approach, even though we are decentralized, so that we could use a shared resources model to help bring our rural counties and those with less resources kind of along with us as we do these data modernization projects. So our decision was to conduct 18 different focus groups throughout the public health system. These 18 focus groups, each of them was on a different area of public health. And we tried to reach as far and wide as we could. So we did a whole session on environmental health. We did one on chronic disease. We did one on infectious disease. We did one on preparedness. Every area of public health that we could think of that operates in different things. We did one with individual public health services, which included our maternal and child health care and direct services that happen as well. So we tried to cover the whole gambit. 3 of those were with tribes as well to get as much information as we could for this assessment. That resulted in over 30 hours of session transcripts. We used the transcript tool in Google Meet to record these meetings. So we ended up with we ended up with 20 different transcripts and over 60 hours of total transcripts. We used Notebook LM for this qualitative analysis. So this is a screenshot of when we uploaded all of the documents. On the left-hand side, you can see all of the different transcripts that were uploaded. And then in the middle, Notebook thought it was being funny and assigned an emoji to the project. And that was the one that it gave us for the listening and learning sessions. And then on the right-hand side is the audio overview, which is affectionately called the podcast tool, which you'll see an example of later on. So with this use case, to prepare for it, I took a Google AI prompting course from Coursera. Coursera is a really great tool that has a lot of different trainings and kind of like workforce development tools in it. So I was able to take the full Google AI prompting course to prepare for the prompts. And in the end, we were able to use Notebook LM to do 60 plus hours of transcripts in 1.5 hours, an hour and a half. We got all of the transcripts done with the qualitative analysis. We decided to do a comparative analysis to validate the AI results that we got from Notebook LM. So we chose 3 of the session transcripts and used a manual qualitative analysis tool called NVivo. Now, NVivo does have an AI function in it, but it is not one that has been approved by our software approval board. So we did not have the AI tool in NVivo. So we were doing the manual process in NVivo to do the qualitative analysis. And that process took 7 hours per session. So these were the prompts that we ended up generating from after taking the training and then deciding what we wanted the outputs to look like, what we wanted to get from the tool, and with a little bit of iteration. These are the prompts that we ended up with. So what key DMI stands for data modernization. So the first thing we did was instruct the tool that from here on out, DMI means data modernization. So what key data modernization challenges and opportunities are identified in this transcript? Make a list of key DMI challenges and opportunities talked about in this transcript. Create an executive summary of the input. Include themes, topics, areas, sentiments for each discussion point. Use a professional tone. Write a 1-page summary about the above input. And then our PIO requires an 8th grade reading level. So we said make it an 8th grade reading level. Create a SWOT analysis, so strengths, weaknesses, opportunities, and threats based on the discussion from the transcript, specifically focusing on. So then we used the definitions that we wanted the AI tool to use for strengths, weaknesses, opportunities, and threats. Then we instructed it to compile a list of potential data projects or data modernization projects mentioned or implied in the discussion. And list them with the most support first, and then to identify action items mentioned in the script. So this is what we started with. We did the same inputs. We wanted consistency across the analysis. So we used the same inputs for all of the different sessions. So for all 18 sessions. And then in Notebook LM, actually, can I go backwards? Yes. Okay, so in Notebook LM, when you put your prompts in, there's these little check boxes next to the material that you upload. You can check and uncheck those as needed. So CLEHA, that you can see here, the CLEHA, that's our environmental health specialists. And so those 2 were checked when I did the CLEHA session, and then everything else was unchecked. So what we were able to do was do an analysis for each session individually, and then I hit select all sources, and we put the same prompts in for all of the sessions so that we could get an overall summary report. So back to this. After using these prompts across all of them, we found some mistakes that could have been iterated out. So the first and second one were duplicative. The AI model put out the same responses for both. So we didn't need to do both of those. So one was eliminated. And then the 1-page summary at the 8th grade reading level was not useful. And we did some research on this because it was coming back incredibly simple. Like it it felt like lower than an 8th grade reading level to us. So we did some research, and it turns out that the generative AI tools do not necessarily get reading level accurate. So it's important to run it through the reading level tester. If you want to take something to a different reading level, run it through a separate tester afterwards to make sure that it's at the reading level that you actually want it to, because it tends to be off by 1 or 2 reading levels. So this was not useful, so that portion of the output was eliminated as well. Since then, we've been able to use AI recently to take a document that we needed changed reading level, put it through the AI model, asked it to change the reading level, and then tested it. It still came out at different than what we wanted, but it was closer to what we needed, so we were able to use it. But yeah, just to be careful of that when you're looking at things. So as a comparison, total time with the AI model was 1.5 hours. Total time with NVivo was 7 hours per session, which would have taken us literally weeks, if not months, to complete for all of the 20 transcripts that we had, and over 60 hours of material. The AI model, both the AI model and NVivo, the manual process, was successful at gathering overall themes and sentiments for the qualitative analysis. The AI model struggled more with pulling out specifics and quote extraction. I'm going to show you what I mean in a second with that. And the NVivo manual process was able to successfully, because it was a human reading the document, was able to successfully pull out the quotes and specific examples of the overall themes and sentiments that we were looking for. Part of that is the transcript quality. So because we use the Google Meet transcript tool, if only one person in the room was logged on to record the meeting, then it was only recording all speech in the room through that one user. So in the, I think it's, actually you can't see that very well. So it would record, like if I was the one recording the meeting and there were 16 people in the room and we were all talking and discussing, it would put every word spoken in the room under my name as like that I had said everything. So it ended up mingling a lot of the language. If folks were kind of talking at the same time or anything like that, it would record it over each other. And so it was harder for the AI tool to separate who was saying what from the transcript quality that we had. With the manual process, human in the loop is a common phrase with using AI, of just basically having people review AI outputs to make sure that it's accurate and not a hallucination, and then that it's everything that you need. So using the human in the loop approach was better because we were able to interpret the transcripts and pull out those specific quotes. So this is an example that we pulled from NVivo. So this is the transcript on the left. The black lines are just people's names and specifics. So you can see in some of this, people are talking over each other. So like this phrase, for example, so they're the trusted community members as well, which is important. Yeah, community health workers, that is fantastic. Okay, let's look at 3 in the middle here. So it doesn't necessarily make sense in the transcript, but you can kind of pull out what's meant. On the right with NVivo, this is an example of how qualitative analysis works through this tool. So with qualitative analysis, we created a code book, which was the specific themes and sentiments that we were seeing. And then we used color coding to highlight those specific themes. So when you could just highlight a section of the transcript and then tag it as data access or a negative sentiment or data sources or whatever it was that you were looking for or that you found with your code book. And then it runs it horizontally or vertically along the side here so that you can see which sections of the transcript talk about that specific theme. So comparing that to the AI tool, this is a transcript from one of our sessions with surveillance, I believe. And And so with this one, so you can see the AI output in the middle under the specific topics or themes that it pulled out. So governance and policy hurdles, people and workforce capacity, and then the bulleted list underneath is those main thoughts. And then the number next to it is the number of references in the transcript to that specific thing. So if you click on it, it pulls up a box like this that can show you the section of the transcript, but it doesn't pull, it couldn't, even though I asked it to, it couldn't pull out the specific quote that it was pulling this conclusion from. So you can kind of see here where it's pulling this from. We want to share access, but we're not always willing to share. That's something that could be valuable. But in the next section, it says in the area, and then it means, I think, like with that, like, I don't know the extent of the CBC one that we're not able to do. So it's like very confusing to look at that quote and be able to see that this was why that conclusion was pulled out. But we were able to validate these results because we also read the transcripts and because we remembered these quotes from the meeting. So moving right along. Some of the benefits of this is cost savings. It took us 9 months to acquire the in vivo license through a number of bureaucratic hurdles from our own agency. And the in vivo license has a cost of $1,500 for a single user license. The Gemini user license is just an addition to the Google that you already have. And for our agency, it was no additional cost to the existing license. I will say that I don't know that that's going to last forever. I can imagine that people are going to start charging for AI once the use cases are established, but right now it was no additional cost for us to do this. The in vivo AI use has not yet been approved. So we used Gemini and NotebookLM as a substitute for that. There was a lot of time savings, which I've already talked about. And then it eliminates the need to purchase further qualitative analysis licenses for other users if everyone just has this particular license. So the AI outputs, we took the outputs from AI and turned them into 18 different listening and learning session summaries. We had one full scoping project summary, so that was the summary of all of the different transcripts combined. And then we also produced 3 podcast episodes. So the 18 listening and learning sessions, to again have another human in the loop moment, we sent those session summaries back to the participants that were in every single session to make sure that they could validate the results. So we sent those back and asked them to give them edit access and said, please change anything, add anything that you feel like was missed from our discussion. We want to make sure that this is representing your voice well. And we added a note on the bottom that AI was used in the process of creating the document. So we got that, the user validation, and then because we sent those back to the participants were able to use the conclusions that we got during the focus groups for their own planning and data modernization and strategic planning efforts. And then the full project summary was used to create a strategic plan for data modernization in Utah for the next 5 to 10 years. And then the 3 podcast episodes. So I'll get into that in just a second. So this is what the summaries looked like. We did a quantitative analysis along with a qualitative analysis. So that's the top part here. This is a screenshot example of our surveillance listening and learning session. So we asked each participant, well, I should start with this. We created an assessment tool with help from the PHII's Public Health Informatics Institute Data Modernization Toolkit and the Rocky Mountain Public Health Training Center, some materials that they sent us. We created our own data modernization assessment tool for Utah. And we focused on 7 different areas of data modernization. So data access, sources, quality, and processes, and then infrastructure, governance and policy, and people, meaning workforce. We asked participants in each session to give a rating for each of those different categories on a scale from 1 to 5, or from 0 to 5, with 0 being the worst and 5 being the best, on where they felt like their particular jurisdiction or public health practice fell within that scale for that particular category. You'll see the NA under data sources. That's because the question with data sources was, where is your data coming from and where does it go? So the rating scale was not applicable to that particular category, but the other 6 were all given a score from 0 to 5. Then those scores were totaled and then averaged, so that we could see the kind of overall arching sentiment. With scores closer to 0, those areas have more room for improvement, and scores closer to 5 represent stronger areas from a data modernization lens. And then we included the AI outputs below as edited a little bit to make it a more comprehensive and cohesive document. So they are linked in this slide that will be sent out, so you can see these summaries if you want to. And then our overall session summary is also linked here. Okay, so this is the podcast. This is the podcast function of Notebook LM. So what we did, we used all the documents as inputs. So we had every single one of them checked. And then on the left-hand side of Notebook LM, there's an audio summary tool that we asked it to summarize what was going on in the transcripts and turn it into a cohesive summary. So I'm going to play a snippet for that for you now. This is completely AI generated, AI scripted, and AI voiced. So it's kind of fun. It's 12 minutes. I'm not going to play the whole thing, but enough so that you can kind of get a taste.
Okay, so today we're going to dive into a pretty big topic.
Yeah.
It's Utah's data modernization initiative. And basically the state's trying to revamp its whole public health data system.
Right. Bring it into the 21st century.
Yeah, exactly. And we've got a lot of information to sift through here. We've got summaries of what people are actually saying, stakeholders, those who are working with the data, and then the overview of the initiative itself. So
a lot to dig into.
Yeah. So our goal is to figure out what are the biggest takeaways from all of this. What are the challenges they're facing? What are the opportunities? And, really just figure out why this matters for everyone in Utah.
Absolutely. And, I think it's important to start by saying that, data modernization in public health can sound really technical.
Oh, yeah, for sure.
But really, it's all about giving the state the best possible tools to figure out what's going on with people's health and then how to respond to it,
Right.
So it's kind of if you think about going from handwritten notes to a whole, digital system, but way bigger.
Yeah, way more important.
Way more important.
Way more impactful.
And it's not just about new software either.
Yeah.
It goes way deeper than that.
Yeah, definitely. And for our listeners out there, who want to get the gist of this quickly, but also understand it thoroughly, I think we've got some really interesting stuff here.
Oh, yeah. I think they'll be surprised by some of this.
Yeah.
So that's kind of a fun little snippet of what an AI-generated podcast episode sounds like. But yeah, a very fun way to kind of summarize everything, and in 12 minutes be able to send this audio file to folks, and they can listen to it and get the general gist of what everything was. So yeah, our conclusions about the use of this Google Gemini product in the Notebook LM. This massively accelerated our timeline for our full scoping project. Using this tool to conduct qualitative analysis of 60 plus hours of focus group transcripts in an hour and a half saved us weeks of manual work while delivering a quality product usable for public health decision making. So we're very glad that we were able to use this tool and validate it using the in vivo license, and yeah, now use these tools for public health action. These session summaries are now being used. We produced our full state strategic plan, and now where there's a preparedness data modernization plan being created, as well as a chronic disease data modernization plan that we're also very proud of, using these session summaries as the basis. So I want to give some acknowledgments to some folks that definitely helped with this. Jeffrey Eason, he's our communicable diseases office director. He is, I forget what the actual phrasing of the title is, but he's a certified generative AI model trainer. So he helped with the prompt generation and iteration and taught us how to use the tools. Nicole Yerkes is our data modernization director, who definitely helped with all of the listening and learning sessions and advocating for this as a use case for AI. And then Chloe Lam is our data modernization intern, who did the manual qualitative analysis using the in vivo tool. So 21 hours she spent on those 3 sessions to do the comparative qualitative analysis, which was huge for us. So with that, I think I am ready to take any questions if there are any, or open up the discussion, but I'll pass it back to you, Andrea.
Awesome job, Kate.